Chapter 10. Glass. It was unsettling to find myself back at Radestad, the same hospital I was taken to immediately after my stroke and where I had my thrombectomy. The delays didn't help my uneasiness. A seemingly endless amount of paperwork needed to be completed before they moved me to a room. I wondered if I might have been examined more promptly if I had arrived in an ambulance instead of a taxi. The nurse who had accompanied me from Klimendal held my hand as I waited. I cried as I tried to say husband to her. She squeezed my hand tightly and nodded to let me know she understood. "He will be here soon," she said in a soft voice. During that wait, my right eye regained its sight for 5 minutes, but then the gray curtain returned. Remco blanched when he finally arrived with our son Martin soon afterward. He was experiencing a frightening replay as he saw me lying there helplessly, without a neurologist in sight. Another 30 minutes passed before the emergency room neurologist came to see me. This young woman immediately reminded me of the doctor that had kept me waiting for 5.5 hours while a clot caused havoc in my brain and killed an endless number of neurons. Remco stood nearby, telling her the essential information about my previous stroke and thrombectomy. His voice was agitated, since he could see that the same situation was unfolding again. He had driven 40 kilometers to meet me at the hospital and had beaten the doctor to my bedside by 15 minutes, when she was only down the hall. Remco knew from experience what could happen with that sort of long delay. "You should scan her immediately," he demanded. The doctor's body language indicated that she was annoyed at him for being insistent or offering an opinion. As she finished examining me, it was almost as if she slowed down while writing out her instructions for an echo and visit to the hospital eye doctor, saying, "Someone will take you there." She didn't seem to be in any hurry whatsoever. Minutes ticked away, at least another quarter of an hour, as Remco regularly returned to the nurse's station to ask why it was taking so long. When the doctor returned, she made it clear that there was no one available to take me to the scan. She suggested that she walk us out of the emergency room and Remco could bring me back into the main hospital himself for the scan. As Remco turned my wheelchair around a tight corner, he accidentally hit the doctor's ankle with the chair. To her, "Ouch," he replied, "We're in the emergency room, so don't worry, you can get treated right away." She gave him an icy, deadly look. As all of the unpleasantness with the doctor unfolded, my right eye continued to open and close that shadowy curtain, sometimes with crystal clear vision, then totally blind, then back to partial vision. Hours passed like that as we waited to be seen for the echo. My face and throat were scanned. I was told that there was no visible blood clot, so we were instructed to proceed to the eye clinic next. We entered the waiting room in the eye clinic and could see that it was filled with patients, most of them over 70 years old. I was exhausted and beginning to grow impatient with how long everything was taking and how many departments we were sent to. Remco and Martin seemed worried as well. When Remco tried to convince the receptionist that I was an urgent case, she rather brusquely said, "Sit down, Mr. De Vries. The doctor made no notes about anything urgent regarding your appointment." We waited another hour and a half as more old people came and went to their appointments. When we were finally called in by the eye doctor's assistant, she asked a range of questions before the doctor arrived. He was a middle-aged man, and we were told that Remco would need to answer for me if it wasn't a simple yes or no question. As the doctor began a more thorough look at my eye, he turned to Remco and asked, "Why didn't you get an MRI?" "I don't know," my husband replied, looking somewhat startled. Suddenly, the doctor was in a hurry, signing papers and handing them to my husband with the brisk instruction, "Go to the stroke unit right away." Remco hastily rolled my wheelchair to the stroke unit, where they took a scan and injected blood thinners immediately. But by that time, my right eye had lost all vision. They assigned me to a hospital bed in the stroke unit, and I waited. My sight never returned. Later that day, Remco was asked to talk to the supervisor of the ER doctor that helped me that morning. The supervisor told him that the young doctor felt threatened by his remarks, and Remco said that he understood. But he also explained his side of the story. The bottom line was that he couldn't really have cared less about what she thought or felt when he had been right all along. The outcome was precisely what he had feared. Remco and I were in complete agreement. We were both fed up with Radestad, just as we had been fed up with Slingeland Hospital months prior. When I had a chance to see my medical record at a later date, there was more written up about my husband's perceived threat to the neurologist that day than the serious implications of my medical condition. Lying in the hospital bed gave me time to think and ask myself some questions. What's wrong with me? Why have I had 2 strokes within a couple of months? I already had blood thinners after my first stroke. What's next? A 3rd stroke? I felt hopelessness seeping into me. I really wanted to leave, to get out of there. In all honesty, I did not feel safe in that or any other hospital just then. Remco and our 2 oldest children were there, and I could hear them out in the hall, talking to a nurse. That was my chance. I could make my move. It took me at least 5 minutes to get the railing of my bed down so I could put my feet on the ground. Next, I managed to get my slippers on. Then I unhooked myself from the IV. Taking my 3-legged cane, I made sure to use the sides, the walls of anything that appeared for support. I wiggled away slowly. The most important thing was to keep my drop foot in place. I did that by turning the foot outward. I'm getting out of here, I thought. The annoying old man sitting in the bed next to me sneered, "You can't do that." I just looked at him and thought, yes, I can. It took me 3 minutes to walk the 3 meters to the door. I was pretty happy that I managed to calculate that. I'm on the run now. I was slowly heading for the end of the hallway, at 1 meter per minute. I bumped into the right wall several times because I was not accustomed to being blind on the right side, but I also needed the wall for support. Where was I going? It didn't matter. I just felt like leaving. I went without stopping. The left side of my back hurt enormously. Doctors and nurses walked by. When someone looked at me, I immediately looked away and toward the wall. I felt liberated walking on my own. No one knew where I was. 1 eye, that's not too bad. My inner voice was chatting away as I tried to build my confidence. I was about 2 meters from the elevator when I heard a voice behind me. Here she is. Shoot, they found me. My first escape attempt had lasted for a staggering 20 meters. Mom? Mom! It was Martin calling me. The nurses are looking for you. I mumbled a response, something intended to sound like home. Remco had a concerned face as he caught up with me. I will do my best to get you back to Klimendal as soon as possible, he promised. You don't want to be here right now. I understand. Sit down in the wheelchair, please, and let's go for a meal in the cafeteria. Our trip to the cafeteria did not help, and the day continued to be anxiety-inducing. Losing sight in one of my eyes forever, and the fear that this kind of thing could happen again at any given moment were both depressing thoughts. When I returned to the hospital room, Remco had somehow convinced one of the doctors to come down to talk to us. The doctor listened carefully as he explained that I did not want to stay in the hospital. She understood. She countered that it was risky to let me go with so many blood thinners in my body. She asked me, "Do you still want to leave?" I gave her a sharp look and sarcastically replied, "Toodaloo," slang for goodbye in Dutch. Martin and Elle couldn't keep themselves from laughing a little. But I did not end up leaving that night because Remco and the children convinced me to stay. It turned out to be a long night. I couldn't unwind and rest. I asked the nurse for a sleeping pill, something I wouldn't usually request. Unfortunately, the medication never took effect, and I remained awake for most of the night as my back hurt more than ever. That type of pain is what they call neuropathic pain, and doing something to get rid of it entirely, sooner rather than later, seemed unavoidable. A few days later, Mr. and Mrs. Professor came to see me. This is how we refer to my sister Ingela and her husband Gunnar, one of our family's inside jokes. They are, in fact, professors. My sister is a professor in caring science at Sofiahemmet Högskola in Stockholm. Her husband is an MD and a professor chair in clinical cancer epidemiology at Gothenburg University. Remco was exhausted and glad to have them present because he knew he could use some help and additional insight. He knew that the doctors had kept me waiting too long the first 2 times, unnecessary delays that had devastating results. Remco also believed that I would not survive a 3rd stroke. "Look," Gunnar said in a calm voice, "we will have to get Linda's medical file first. Then I will find out through my contacts at Sahlgrenska Academy Hospital who the best neurologist in the Netherlands is. We will take Linda to him, period." Immediately, I could see the relief on Remco's face. It was as if Gunnar had taken a massive weight off his shoulders. Gunnar received a response from his colleague in Sweden the next morning. His name is Frank Erik Deleu, and he is a neurologist and professor at Radboud University's Nijmegen Medical Center. "How far away is that?" Gunnar asked. He was unaware that 90% of the Netherlands could be reached within an hour from where we were sitting. "It's just 20 to 30 minutes away," Remco replied. Gunnar continued, "I'll write him an email first. If we get no response, we'll go and visit him. We should, however, make sure we have Linda's file from Radestad before we go." My sister Ingela took care of me that day and accompanied me on several appointments with Herma, Joy, and Marlin. Marlin was a psychologist I had grown to like and trust. I felt that she was on my side when she made arrangements to help me cope with the pain. One of the methods she used was EMDR, eye movement desensitization and reprocessing, an integrative psychotherapy most commonly employed in the treatment of traumas. If my therapist measured my pain on a scale of 1 to 10, a level 3 was uncomfortable but bearable, and a continuous pain at 7 or above was too intense to cope with. My pain level was usually around 7 at that time, and using EMDR brought it down to 4 or 5. However, at night, the pain always came back. When I was eventually able to say some words, I tried to convince her that I needed some additional changes, made with my occupational and physical therapists. Basically, I wanted to change Daphne, my speech therapist, and have the opportunity to see more of my favorite therapists. Herma, Lisette, and Jeroen were my favorites. I only saw Lisette a few times, but I immediately noticed that she was very competent and had a lot of experience. I met Jeroen, my physiotherapist, a few times during hand electrical stimulation. During those sessions, he observed how little my pinky finger moved. Electrical stimulation pads were taped onto my arm, and a small device sent electrical waves through my nerves in the hope of activating the connections between my brain and my arm again. Much later, after I had left Klimendal as an intern, I wrote a note to Jeroen. Something along the lines of, "Do you want to be my therapist at home when I leave Klimendal?" Unfortunately, he replied, "I can't do that. Klimendal doesn't allow me to see patients outside of the clinic." That disappointed me. Of the dozens of therapists I had seen, I would have preferred to only work with Herma, Lisette, Jeroen, Marlin, and Femke, a brilliant speech therapist I connected with later in my recovery period. My reasons for choosing that specific group of people were related to the coffee lady I observed in the hospital right after my stroke. No matter the therapist, I always took the time to observe them carefully. My favorite therapists were all smart, no-nonsense people. They treated me like an intelligent human being that fully understood what they said. Last but not least, they were all kind. In my mind, a kind person is someone who lives in a more awakened state of mind, making the right ethical choices from within his or her heart, A kind person carries consciousness within and has a continuous concern for fellow human beings. In a book I read some 10 years earlier, The Art of Being Kind, by Stefan Einhorn, the author proposes that only 20% of the population possesses the type of kindness I just described. The remaining 80% do not. Looking at the world around us, that made sense. My sister Ingela took care of me. She wondered out loud one day, "Why are you wearing jogging pants all the time?" Soon after, she returned with some lightweight pants, a t-shirt, and a pair of easy-to-put-on Velcro sandals, since she often took me outdoors. One day, she also brought a ball I could put my left hand on and around. That was rather difficult for me, since my spasticity seemed to be getting worse every day. The spasms made it difficult to keep my fingers open, and my left hand was cramping almost continuously. I couldn't set my fingers down on the ball without first prying them open with my right hand. Trying to force my left hand open with my right hand also took several minutes, due to all the ongoing spasms. It was time to get more language back. "Focus on the Swedish words," Ingela said, so I did. We took opportunities throughout the day to work in time to practice. Once, we were having lunch with the whole family. The Ronald McDonald House, above the clinic, provided a perfect family-like environment and got us away from the hospital atmosphere. We had just ordered sushi when Gunnar held up a glass and asked me, "What is this?" I sat there, thinking hard, trying to come up with an answer to his simple question. I concentrated more and more, but I still couldn't come up with the right word. I had failed once again, and I hated feeling stupid. A strong sense of determination took hold of me in that moment. I needed to remember that a glass was called glass. 2 days later, I was checked out of Klimmendal for a weekend at home with family. We went to a restaurant for dinner, and Remco's sister, Carmen, also came along. I made sure to catch Gunnar's eye, pointed at my glass, and casually said, "Glass." He smiled back at me, and I felt enormously proud. Gunnar didn't know that I had been practicing for hours and hours on the word glass for the previous 2.5 days.